The recent study examining the effects of obstructive sleep apnea on memory-related brain structures offers an important opportunity for greater understanding and, potentially, for hope. While the findings confirm a link between low oxygen levels during REM sleep and damage in memory-critical areas of the brain, including the hippocampus and entorhinal cortex, the implications are not purely negative. On the contrary, this research opens the door to earlier detection, better management, and more personalized interventions for cognitive decline, perhaps even giving us a new tool in the fight against conditions like Alzheimer's disease. Sleep apnea is widespread, affecting millions of people globally, and often goes undiagnosed. This study shows that its impact isn't just on daytime fatigue or heart health. It's intricately connected to how the brain processes and stores memories, particularly during REM sleep, a phase known for consolidating learning and managing emotional experiences. For researchers, the fact that the damage correlates so clearly with oxygen levels during REM sleep is actually a breakthrough. It provides a concrete biological mechanism by which sleep disturbances may influence long-term brain health, a critical step in moving from correlation to meaningful intervention. Importantly, these findings do not suggest that cognitive decline is inevitable in those with sleep apnea. Quite the opposite. The results underscore that the condition's effect on the brain is measurable and modifiable. The study involved participants who had not yet developed cognitive impairment, meaning these changes may occur well before clinical symptoms arise, an insight that offers a valuable window for prevention. If we can identify at-risk individuals early, based on oxygen levels during sleep or the presence of white matter changes, we may be able to slow or even prevent progression through treatment. There's reason for optimism in the fact that sleep apnea is treatable. Continuous positive airway pressure, CPAP, therapy, for example, has already been shown to improve oxygen levels and reduce apnea episodes. Other methods, including oral appliances, weight management, and lifestyle changes, have also proven effective for many patients. With this study linking brain preservation to oxygen saturation, it becomes increasingly clear that these treatments may not just improve sleep, but could preserve cognitive health in meaningful, long-lasting ways. Moreover, this research brings visibility to a condition that has too often been dismissed as benign or merely disruptive. By demonstrating a clear connection to memory and brain structure, the study elevates the urgency of screening for sleep apnea, especially in older adults or those with early memory complaints. It also underscores the importance of looking at sleep as a core pillar of neurological health. In doing so, it paves the way for sleep specialists, neurologists, and primary care providers to collaborate more closely on holistic patient care. From a scientific standpoint, this is a moment of progress. The use of brain imaging to correlate sleep oxygen levels with structural changes in the brain gives researchers a powerful new biomarker, something that could help track the efficacy of treatments or even predict which patients are most vulnerable to memory loss. With further study, this could lead to customized treatment plans that address not just sleep quality, but individual brain resilience. Finally, it's important to recognize the empowering nature of these findings. Sleep is something we can actively work to improve. Unlike genetic risk factors, sleep behavior is modifiable, and interventions can be implemented relatively quickly once the problem is identified. For individuals worried about cognitive decline, this means there is something they can do: get evaluated for sleep apnea, seek treatment, and protect their brain. This research doesn't just warn us of a risk. It gives us a direction. It points us toward proactive steps, encourages us to take sleep health seriously, and offers tangible methods to preserve memory and cognition well into old age. In a world where many neurodegenerative conditions still have no cure, studies like this offer a rare thing: the chance to make a difference now before symptoms appear through something as accessible as better sleep care.